Dr. Whaley, how are you?
I'm great, and yourself?
I love the sunshine. It's going to be a beautiful weekend. Might be a little cool, but a beautiful weekend. Love the sunshine. It's been raining a little bit. This is quite a live, active show. Now, I want to extend an apology to anyone that's in the field of dentistry or orthodontics. I am not.
How about periodontists and endodontists?
All of them.
Okay.
Okay. I was just making an example.
All right, go ahead.
The last person I want to upset is the dentist. They bring this drill, and I'm like, I don't want them upset, you know what I mean? But you understood the comments I was making.
I did, yeah.
So thank you for all the live comments, and we have a live question for you this morning that came in as we were on. We'll talk about that in just a minute. Dr. Whaley with the Georgia Cancer Specialists, we want to thank them always for our segment, and look at the logo on the top there, and we always appreciate them for sponsoring that.
Georgia Cancer Specialist of the Northside Cancer Institute.
I have to practice that.
You do. Go ahead.
Okay, you
gotta go. It'll take you weeks to get that right.
We have the logo on.
Yeah,
I gotta practice that whole
right.
line. It's hard for me on Fridays to remember I'm at Circuit World.
Well, I got to tell you, the program you did Wednesday,
yes,
I thought you were advertising TVs, because the way you had the set up, you had all the TVs and the two different things, and you didn't really realize how extensive the TV display is here until you saw that thing on Wednesday, which was very good, by the way. And
did you enjoy our?
Yeah, I watched 75 minutes of it. I watched the hour before I started seeing patients, and then I got kind of boxed.
Did you watch the one lady over here that asked that question? What was her name?
Yeah, I noticed it was and I tell you, I was impressed, but it was good. And one of the questions we're going to come to today is going to reflect on that some more. And the other thing I was going to say, you remember a few weeks ago, I had to go down to the. I went down on Thursday night so I could get back here on Friday morning, because my barber of 50 years had died. And everybody called him a hairstylist instead of a barber.
Right.
And so I noticed that you found your own hairstylist up here in the mountains. Not a barber, but a hairstylist. And I just...
Easy over there at the table, no comment.
Congratulations on the hairstylist thing. All right.
All right, okay.
Get to work. Go ahead.
Hey, by the way, JR, he said he watched that program. I want to know if TV sales went up after Wednesday.
Yeah, JR, you had a lot of great TVs on the Wednesday program. Go ahead. Now you want to get to that with a call-in question first?
Yeah, let's get to the question that we got live this morning. Somebody sent us a question, and don't forget, throughout the week you could send an Ask the Doc question. Ask the Doc to Doctor for Dr. Whaley on Fridays to info at fetchernews.com, and we'll get it to Dr. Whaley. But this came in live this morning, and Dr. Whaley wants to answer it or make a comment on it. What is your opinion on cheaper international cosmetic or general surgery, for example, in Mexico, instead of having cosmetic or general surgery in the U.S.?
I think it's a great question, really. And when you call in these questions, let me say, frequently I'm not real smart. So the question will get set aside for me to go research it, and it'll come back the next week. But okay, I can answer this one. Much dental surgery, knee and hip replacement, facelift, breast augmentation, types of surgery that are cash-based, they're not insured, you've got to pay for them on the open market. There are many places in South America and in Central America, Mexico being one, where the physicians and providers have been trained in the U.S. or have been trained in Europe, or are very well trained. The places are highly rated. They're clean as a whistle. You can get good reviews of Europeans and so forth that have gone there. And that would be particularly dental work that you have to pay for that's not insured, the facelift, the breast augmentation, and things that come out of your pocketbook. If you look at, I hate to say, if you look at Brazil or Colombia, they're famous for women that wear these bathing suits that are no bigger than my glass of thing.
I have no
here.
idea what you're talking
and
about.
I know you
sir,
do, but
you know, for the viewers
so
out
quite,
there that may
so
understand,
may understand. So quite often,
just continue to talk.
quite obviously, they have very competent cosmetic surgeons in Central and South America. Yeah, the issue would be do a whole lot of due diligence. And I think it's entirely reasonable and safe. Now, if you're going to get a hip replacement or a knee replacement, insurance is going to pay for it. I think I'd get that here. And the Canadians come to America to get theirs, and so.
But the due diligence, make sure
the due diligence.
Right.
And there are a lot of great doctors down there. We train them. So I would tell you, particularly the things you got to pay for out of your pocket, and that would be dental, some fancy cosmetic work in your mouth, and plastic surgery.
Thank you for that question. Again, info@fetchernews.com throughout the week, and you can send a question here. Thank you for emailing that question. Let's get into, I don't know if you have a particular order on the questions.
Stick with the order that came in, because that's the way, I got my mind on that this
Oh,
week.
so you're working in, okay, I've been told to stick to the order.
Well, at least for number one.
Okay.
Because we might be stuck here all day.
In the view of progressive violence in schools and the claims of mental illness, what, in your opinion, would make more and more children have these issues? We did not, at my young age, somewhere in the 40s, no laughing over there, we didn't talk about mental illness. Where are we at on this, where this question is concerned?
First of all, I want to hook this to your Wednesday discussion, because the Wednesday discussion had the superintendent of schools of the two counties closest to us, the sheriffs of the counties of the two closest to us, and the school resource officers of the counties two closest to us, and they were talking about what you do in a shooter scenario and trying to recognize the at-risk child and that sort of stuff. And that's kind of like when your vehicle's going 110 miles an hour and you're trying to wonder how you're going to stop the crash. How do you keep the guy from driving 110 miles an hour? Quite obviously, since I think Amanda said there'd been 13, 15, 18 at least recorded hopefully false alarm alerts in the last week.
Just here in Georgia.
Just here in Georgia, yeah. I mean, they're all over the country. The medical community has also been pouring out suggestions and information. And interestingly, on Monday of this week, in the American Journal of Pediatrics, which is the oracle at Delphi in pediatrics, Canadian and American pediatricians and primary care physicians and mental health professionals all made a recommendation that slightly changes the recommendation they've had for the last 10 years. And that was that every teenager, think about that, every teenager have a psychological mental health assessment every year by his primary care physician. Now, I'm going to guarantee you hardly any teenager goes to see a doctor every year. I mean, do you? I mean, think through that a minute. And the reason for that is that nobody's supposed to know the kid any better than the primary care physician. I would extend that actually to include schools, include coaches, include teachers, include everybody, family, everybody around, to what sort of the warning signs of an issue of pressure is. And here's the reason that it's felt that this is a new phenomenon that did not hit us. First, the facts first. Greater than 50% of childhood depression, say mental illness, is not recognized nor diagnosed. And of those that are recognized and diagnosed, fewer than 10% are treated. So that means that huge group of kids that have mental health disorders are not being treated. Now, I want to make this a little bit, I may be going out on a limb here, but first of all, the things that make it so hard on kids today that did make it hard on me and you was social media pounds them to death. the idea of cyberbullying is huge and new. I'm going to pick on you a minute. So I'm going to imagine that you were a little chubby kid in the first grade.
Wait a minute, whoa. You should tell me this, not on live. You don't do this on live. You just tell me.
All right.
You call me. All right, so I'm the chubby kid in first grade. Go right ahead.
I'm just making for an example. Okay.
You over there don't laugh.
Okay, in our day, any kind of stuff would have been 2 or 3 good friends that you went with, and I was called Whale Tail because my fanny was wide. We had a guy we called Tiny. Well, early Tiny grew 8 inches when he was 14, but he was a little kid, so we had a nickname for him, Tiny.
I don't want to interrupt you, but I will say this: I'm glad you're going this direction, because when I'm going to say 7 years old, and there's 10 of us 7-year-old boys. Not a one of us knew each other by our real name.
Oh, okay, they got a nickname.
Okay,
now,
I'm with you.
Today, that becomes cyberbullying on Facebook or whatever they call it, where they talk about the kid with the big ears, or they talk about the kid that's racially mixed or whatever it is, and they pound that kid to death. Whereas in our day, it'd have been your 5 or 6 year kids, and you'd have called him Porky, you'd have called him Dumbo or something. Everybody had a nickname. They go say, so cyberbullying is huge. Then they've got this I don't even know the names of all them, Snapchats, but anyway, social media, whatever the heck you call the thing. And then lastly, they're suffering post-traumatic stress disorder. And listen to this, Sam. Y'all quit talking over there. Post-traumatic stress disorder. I want you to think this is the 50th anniversary of Vietnam. Changed the country as much as the death of, it was thought to be one of the 5 biggest events to ever occur in a Western culture was Vietnam, the death of Kennedy, the death of Lincoln, because they fought the war in the living room. And Mama saw her son liable to getting killed out there, and Mama was mad. And then that created a huge social upheaval and the anti-war movement and the student movements and everything else, and we lost our confidence in the president because he lied. Well, these kids have post-traumatic stress disorder because all day, every day, when they see on TV, they see this school shooting, they see this guy that blew up a train. They see that car running through hundreds of people there in the south of France. And they are so imbued with trauma of real traumatic events. And then their games are those things where they're shooting people and everything. So violence has risen to where for us it was ball. Or hunting cowboys and Indians. In other words, the things that they do all day, every day, are violent, and then they have all this. They have all this stuff where they see people. They play with violence, and they see where people use violence to kill people, like those big old trucks, and then they're getting bullied because they got big ears or whatever it is on the social media, and it's so much more traumatic for them. That the incidence of depression, the incidence of aggression that is below the surface in adolescence is extremely much higher than it was in us. So, people aren't going to take their kid to the doctor every year like the American Academy of Pediatrics suggests. So, all of those people in the network really need to be educated on what are the warning signs and how do you bring them out. From
coaches to teachers.
Coaches to teachers to church, everything.
Warning signs on these things that they could report to somebody of authority.
All right, now,
not of authority, but I mean of. Oh, go
Here's
ahead.
what they're going to do.
Well, all right, tell us what they're going to do.
The coach is going to call in the dad or the mom and say, look, I'm worried about Johnny. Okay, the coach and the mom's going to take them to the pediatrician or primary care physician. Here it gets to be crucial as well. That coach, that primary care physician or pediatrician has to talk to the child alone. Because that child with his mama's going to answer the questions for him. 2 days ago, I saw a emancipated patient, meaning 18 or over, with a very complicated medical history, whose mother was there, and I said, would you like to let your daughter talk alone? No, I'll stay. So I go start going through this history and ask the girl questions. Mama answers them all. I actually had to send Mama out of the room to learn what was going on with that girl. So now you've got this 8-year-old kid that the coach or somebody says has got a problem. Mama takes that kid to the doctor, and the doctor goes through a brief, you've seen those alcohol questions. Cage, it's only 5 questions. It takes you less than a minute to do it. And we talked about Alzheimer's screening in here a few weeks ago. And you can do that in 1 or 2 minutes. So we're not talking about an hour psychological evaluation. But that doctor wants to ask that kid some things and get him to talk. And Mama sits there and answers the questions. So he's got to be able to talk to the kid alone. And then he's got to be able to talk to the parents. And if the doctor's good, Ray Tidman's good, I know these guys are good, then they'll be able to tell you this kid really is hostile, he's depressed or whatever, and that then sort of is the steps below where you were with your expert panel and the how do you stop the shooter situation the other day. So anyway, this question is, why do I think it's gotten so much worse? I don't want to call it total mental illness, and it's all of the stuff that's here today that wasn't here before. And that's cyberbullying, social networks, and the like. And that's enough of that.
Well, no, I mean, we're going to probably get into that with the All-Star panel. And I will say this, you want to stick around for the All-Star panel because if you know me well enough, Dr. Whaley brought up nicknames. So when we get into the All-Star panel where we can horse around a little bit, I'm going to tell you a nickname story, okay? But we're going to wait for that.
Ooh, I got to give you a nickname.
Oh, no. We got to move. You already called me the chubby kid in first grade.
I did, but I mean, I got a nickname.
I'm just going to say,
if you ask one of those what their nickname was, you'll get a hoot out of it.
Okay.
It didn't last long, but it was embarrassing. Okay.
I read there is a specific test for ovarian cancer. Should I ask my doctor for a CA-125 blood test to screen for ovarian cancer?
Well, that's actually 2 questions, because the CA-125 is not the test that has been recently touted as being a fairly specific blood test for cancer detection. And there is nobody in the world who believes that a CA-125 test should be done routinely on a woman to diagnose cancer. So the answer to the question is you should not ask for a CA-125 test to diagnose cancer. Now, the writer of that question didn't really realize that just take the whole CA-125 out of it, and there is a specific test that is being evaluated at the present time that is frequently touted in the news as being a huge breakthrough, and it is a breakthrough that isn't ready for prime time yet, that is called the liquid biopsy. Sam, you heard of a liquid biopsy? All right. So a liquid biopsy draws blood out of your arm. No needles, no knives, no surgery. And then that liquid biopsy, through all of this fancy genetics we keep talking about, tests that blood for microscopic RNA, which is a genetic material, or for cancer tumor DNA fragments that are specific for different organs. And the ones that they are working on to detect the best are lung, colon, melanoma, prostate, and the last is ovary. So someday, and I think someday is coming really quick now, probably within a year or 18 months, there will be commercially marketed a specific RNA or DNA directed test for one or more of these tumors. But right now, the technology does not exist. It is not available. You can't go to your doctor and get your blood drawn and do it. Although you can in certain places. I know that this is going on at the University of Arizona and several others. you can participate in a clinical trial and have your blood drawn and tested. But to get into that clinical trial, you've got to have a high risk or family history or something so that it gets you in there. But it's a great question. But the CA-125 is not the answer, and the liquid biopsy will be out there one of these days.
Okay, our last question of the day is, can chemotherapy side effects increase the risk of heart disease? Can chemotherapy increase the risk of heart disease?
All right, Amanda, you want to show that map? Show that map. This map that Amanda's getting ready to show here, and I'll show it to you so you can see it. It's another one of those things that looks like a Zika map or something else. But the bright red areas are areas of the country that have an increased incidence of heart disease. So just living in one of those areas of darkness increases your incidence of heart disease, and increases your incidence of heart disease perhaps in the same order of magnitude as chemotherapy in general. There's a second chart now. If you'll take that little chart, the one that says.
I have a question here.
Yeah.
On this one, is this saying like there's more heart disease in Alabama? Is that what that's showing?
Yes.
Is that because they have better barbecue? That's my joke of the day.
It is a good joke. I mean, if you really want to know the truth,
no,
it's
just talking. No, I don't want to get off the. I guess
right, well, okay. Hey, it's another day then.
Yeah, I was just.
All right.
Just wondering
the next question, the next chart she's going to show it is a recommended health risk analysis for people who are specifically treated for Hodgkin's disease, although this exists for everything else. And you'll notice it has people who had Hodgkin's disease treatment with radiation have a higher incidence of cancer of the breast, and we have to do more mammograms on them. The drug adriamycin, which is part of the recipe that's used in breast cancer and in Hodgkin's disease, has some cardiac side effects, and over time it can increase the risk of coronary events from 3% to 6%, but the overall total benefit from treating the patient with the malignancy is that it saved the patient's life. So we know what drugs, let's take Lance Armstrong, because he's a great example. The cancer that Lance Armstrong had was 100% fatal. When he had it in his brain and his lung and he was dying, the treatment that he received at the University of Indiana, we brought it up before, was just being developed by Larry Einhorn, a friend of mine. They call it the Einhorn regimen. One of those drugs is called bleomycin, and it gives you severe lung disease, and it has a reaction that can give you severe lung disease in a very tiny percentage of patients. Well, obviously that happened to Lance Armstrong. He'd never been able to win the Tour de France. So we know that when we've treated a patient with testicular cancer, they've given them bleomycin, then we watch them for lung disease for the rest of their life. And very few develop it. For females who had breast cancer treatment with adriamycin, or anybody of any sex who had treatment with Hodgkin's disease with adriamycin, then they are in a program, and the very first recommendation on that list is, after conclusion of treatment, refer them to a cardiologist for baseline study so that you'll know what they were like when they finished. You can follow them for the rest of your life. So the answer is yes, some chemo, really just a small part of it, can increase your incidence of heart disease, but not much worse than that map that you saw earlier, which is geographic. And so live in Alabama and you got to risk there. How's that?
That's good. I'm sorry, folks. We turned the set around, and now it's like squirrel where I can see out the window. So there's actually things out there that can't. I'm sorry.
Yeah, but you're missing.
We're listening to you, Dr. Whaley.
No, I'm listening to Dr. Whaley too. Now wait a minute. But you turn the set around, and I can see the beautiful sunshine out there in Blue Ridge. And
but you miss the TVs. See, you don't get to see all the TVs that are behind us this way.
Dr. Whaley, you know as well as I do. You see the all-star panel team assembling out there, ready to go. They have their notes. They have everything. But we don't want to close without. Do you have a final statement for today that you'd like to make? We always like to give you an opportunity to give us a closer. You're like that guy we bring out of the bullpen. It's the 9th inning. We need one more out. So
we started off by talking about the school, the adolescents, and why do you feel like they have a higher degree of violence, mental illness, whatever you want to call it. In that same journal that came out, the pediatricians recommending that the kids go get screened for depression once a year, when we know that kids don't go to the doctor once a year, had an article in there about that DASH diet we keep talking about, which is the diet approach to stop hypertension. Well, the purpose of that was not that they were beating that dead horse about the hypertension, the diabetes, and the heart disease. It's that as they have been analyzing this data over the last year, and I've brought it all up about the hypertension and all, they discovered that the people that followed that diet had almost a 20% reduction in depression, anxiety, and mental illness. Now, that's got nothing to do with cyberbullying or any of the other things we were talking about earlier, but I can't imagine why following this healthy diet with the 7 or 8 servings of fruits and vegetables a day and low salt, and that lowers your hypertension and heart disease things, should keep you from being depressed. But that was the last little benefit of following that healthy diet I keep talking to you about.
Well, now wait a minute. Now, you're talking to me about healthy diet. Yep. You've already went on the show here and told the world, because it's the World Wide Web, that I was the chubby kid in first grade.
Yeah.
But I am going to tell you, I'm walking 2 miles 3 days a week.
That's good.
Okay.
That's
so,
perfect.
I mean,
and I give you a gold star. And when you're ultimately up to 20 miles a week and do that for the rest of your life, it will extend the length of your life if you start that below the age of 45 by as much as 8 years. 8 years is a long time.
I'm up to 6 miles.
I know. That's what I'm saying. You're on the right track.
So 2 miles 3 days a week. Okay.
Keep it up.
So may no longer be.
Plus, he got him a hairstylist. Not a barber.
We're going to break on that. I've heard that all week. Dr. Whaley, Georgia Cancer Specialist. You see the logo on the top. We thank them for their support, and I will
Georgia Cancer Specialist of Northside Cancer Institute. There you go.
Oh, I'm going to practice that, okay? Right after these messages, the all-star panel, and you don't want to miss it because Dr. Whaley is the one that brought up nickname. So he did it, so we're going to talk. Don't miss it. Rick, Bruce, and Jane are ready right after these messages. We're at Circuit World in Blue Ridge. Take us out of here.